Welcome to the Permanent Lifestyle Podcast. On today's episode, I interview a nurse who works in the Twin Cities area of Minnesota, and she talks about what it's like on working on the front lines of the COVID-19 crisis in the actual hospital. Her specific area of the hospital is where they actually take in patients who are showing symptoms and they test them and decide whether they go on to an ICU or more intensive type care specialist, or if they're going to be released and go home and quarantine for 14 days. This is some really graphic shit, man, some really hardcore stuff. And we wanted to tell this story because we felt like there was a lot of misinformation out here in the media and in the public. So please tune in, listen to this one very carefully, because I think there's some really valuable information. Specifically, we're going to talk about what are the symptoms and what exactly you should look for if you think you might have COVID-19. All right. I am here with a friend of mine that is a nurse here in the state of Minnesota, and I had reached out to her recently to ask if she would be willing to tell her story about what it's like kind of working on the front lines of the COVID virus as a nurse. I had seen something on social media where there was protesting going on earlier in the week, and I had seen a comment that she had made where she was like, hey, I could just tell by the comment that, that was kind of a slap in her face to some degree, to say people are not taking this serious. And I thought that maybe it would be a good idea to talk to her about what she sees and what's going on the front lines of the fight against this virus. So maybe it would help put some things in perspective for people out there, so they can really understand what's going on. I don't have all the answers. I'm not an expert. I think we've all become experts. I figured let's talk to somebody who's actually out here putting their life at risk every day. And maybe that can bring some clarity to some of the people out there that are kind of on the fence of what's going on and what's going on in these hospitals and these clinics and what's going on with these people. So I'd like to introduce my friend here. She's a nurse. How long have you been a nurse for?
I was an LPN for 17 years and I've been an RN for 2 years.
All right. And you don't have to necessarily state the place that you work at, but maybe give us an overview of what kind of facility that you work at and how it operated, let's say this, how it operated before the pandemic and what your role was there before the pandemic. And then let's talk about how it's changed.
Okay. It was a med-surg oncology unit, and now it's a COVID rule-out unit. We still do have some other types of patients, patients that come in with, abdominal pain, let's say, or appendix issues, or their pancreatitis or something. We do still have those, but we have a whole area now designated to just rule out COVID patients.
So when you say rule out COVID patients, you're saying R-U-L-E, rule out. So does that mean that people are coming to your part of the facility and you're sorting them out based on this person has it, this person doesn't? Maybe explain to us how.
So they come into the ER and they complain of whatever COVID symptoms. Then they're tested down there, and then they're transferred up to our floor. And then they stay on the special unit until their test comes back. And lately, in the last 2 weeks, they've been coming back about in 3 hours. Now, back in, I want to say we're in April, so probably the beginning of April, end of March, they were taking days to come back. They would be stuck there for several days. So that was an issue because there were positive patients and then there were negative patients. So as soon as the test comes back and it's negative, we immediately get them off the unit and transfer them to another floor or down the hall so we don't infect them.
Okay.
Because we are going in and out of other patients' rooms that are positive. So it's a very high turnover. So it's constantly like they'll be up there for maybe 3 hours. And then another one comes in. and it just constantly cycles all day long, all night
What,
long.
you know, you said before your area of the facility, you weren't dealing with sick, let's say sick patients. You were dealing with people that had what kind of ailments are people coming to see you for before this?
So it was a lot of medical surgical patients. So patients that were withdrawing from alcohol, or patients that had pancreatitis, or small bowel obstructions, or they needed to come in for chemo, or they were having chemo side effects and they were neutropenic, and so different things like that. It was a wide variety.
So at what point in time did your facility make the switch? And how did you find out about it? How did you find out that, hey, you're going to go from seeing, I wouldn't say healthy patients, but people that are sick maybe more internally than they are with coughs and flu-like symptoms? How were you told, and how were you guys able to transition to that next phase, to a new phase?
Actually, I was just off of work a couple days, and I came back, and that whole hallway was blocked off to, now it's a COVID rule-out hallway. And so when you're down there and you're a nurse down there, then you stay down there. You don't go over to the other side and care for patients that aren't being ruled out for COVID.
Okay.
So you stay there. But now, like, for example, like I would say last week, I only had 2 patients all night long.
Oh, wow.
That was it. So I was just waiting around for patients to come in complaining of COVID symptoms.
So
basically
what were you seeing the previous weeks then? You said you only had 2 patients recently. What were you seeing prior to that?
Well, prior to all of this happening, we would have, we have about 30 patients on our floor. And then numbers went significantly down to like 10 patients, 15 patients. So there weren't a lot of nurses. But now lately the tests, like last night there was a lot of patients. Like I didn't even get a break last night. I worked a 12-hour shift. I didn't sit down. It was constant. I couldn't even fill out like all the information that I needed. Like I literally like room them, take their vitals, make sure they were still stable, and tell them I'll be back when I get their orders. And then the next one would come, and then the next one would come, and it was a constant all night long thing.
These are patients that felt like they might have symptoms, COVID symptoms then?
They might have COVID symptoms. So you're in full PPE and you wear your N95 always. And yeah, you just treat their symptoms.
And then where do these people, let's say, what happens to them after that? Someone comes in and you're just doing a preliminary, checking them in. Where do they go from there?
So from there they go, if they're negative, then they go down the hall so they're off of the COVID rule out hall or area, and they go down the hall to like a regular room. And if they don't continue to if their symptoms are manageable at home, then we discharge them. But if they require oxygen, or they were found to have something else like a pulmonary embolism or something like that, which we're finding a lot of lately, or I don't know, anything, then they'd go down the hall, or now they're having a cardiac issue, so then they would go to our cardiac floor.
Okay. So then when you're ruling them out and you do find somebody that is going to kind of advance onto the next stage of maybe more advanced testing, would that be how it goes? No,
advanced testing. They're just, if they're negative, then that's it. Then we get them out of there. But if they're negative, and let's say they're still having a really high fever or a real significant dry cough, then we might consider that test a false negative. And then we have to wait like 48 to 72 hours to test them again.
Could you tell?
So then they will there, and then they'll wait. We have to wait, that many hours to then retest them.
All right. So since you're somebody who's actually testing people, could you tell us exactly what are the symptoms that you look for as a physician, or somebody working in the medical practice? What are you looking for so the people listening know what they should be looking for? Because there's so much information out there. Let's hear from the front lines. What should we be looking for?
The high fever and the dry cough and a lot of nausea. We've noted a lot of nausea and these high fevers.
Okay. Okay. So high
Or
fever, dry cough, those are the two things that you kind of see going together where it's like, okay, this is probably somebody that has elevated symptoms, I guess, maybe for lack of a better term.
oh, and another one is shortness of breath. A lot of them, they won't realize how short of breath they are.
Okay.
So they're not gasping for air necessarily, but they'll realize like, oh, that was really hard to climb those stairs, and it wasn't hard a couple days ago.
Okay. Okay. That's good to know. That's good to know. So, you had mentioned that you are in full PPE. Talk to us about that, because there's a lot of reports out there that there's a shortage of this equipment. And where are you guys at with this? I mean, how are you guys being protected, and how are you guys handling, protecting yourselves and not getting sick yourselves?
Well, we hope that we're protected. We use these disposable gowns, but I've heard in the last week that we're going to be changing to reusable gowns, which I kind of feel is better because they're thicker. They're kind of like a parachute material versus these other gowns feel like tissue paper, and they look like tissue paper, and they rip like tissue paper. So we wear those, and then our N95, and then these homemade face shields. And the homemade face shields are like a very thin piece of plastic with elastic stapled. And sometimes the staple breaks, and you just have to restaple.
Do you feel, how do you feel like when you're in the room with these patients, you're basically putting your life at risk, your life of your family at risk? I mean, how are you feeling during these interactions and while you're at work?
Most of the time I actually feel okay because I am a healthy person generally. But if they have a really bad cough, I do get nervous and I do like turn away. Or if I have to draw their blood and they're coughing, I get really nervous, because if my head is bent down and they're coughing and I'm trying to get their blood, they're coughing right into my mask. I'm not protected. It's going right into the side of my face.
Jeez, that's
it's a
very scary. Do you how are your colleagues feeling? Like, how are people, how are the people on the front lines holding up, mentally, emotionally? Where are you guys at?
Most of them are doing pretty good. There are certain nurses that I want to say, like, kind of, we really like to carry for COVID patients. Like, I prefer at this time, now that I've been down there. At first I was really scared, like, oh my gosh, you're putting me down there. I don't know if I can do this. But after I got over that, like in the first hour, they sent me down there. And now I'm usually stationed there every time I work, because once you're down there, then they just prefer to keep you down there. And there's other nurses that are no way want to go down there. And if they have to go down there, they're really upset about it, and they're very scared, and it's just fear. And even doctors still have fear. In the beginning of this, we had doctors that wouldn't even go in the room. Wow. They wanted to assess the patient from the doorway. Wow. Or they were very frightened. And we have some that want to wear 2 N95 masks.
I mean, I can understand.
We had a physician last night. She didn't even know how to put on her PPE, and she didn't know how to take it off either.
Oh, wow.
So that was a little frightening, because I don't know what she's doing downstairs in the ER.
Yeah. Well, they're probably looking for bodies. So they're like, hey, you got to go down there and help out. Are you seeing a lot of people? I know you mentioned last night it was really busy. I want to ask kind of a two-part question. Maybe you kind of already answered this. Are you seeing an uptick in people? And if so, why? Is it fear? Is it reality that there's more people you think that are being affected? What are you seeing? Throw the data, the numbers we see every day. What are you seeing, like, in the actual trenches? Like, are more people affected? Are more people coming in?
There are a lot more people coming in, a whole lot more people coming in. Last night, our ER was constant flow. They're coming in they'll say they had any symptom just so they can get tested, which is fine, and I think we have access to a lot more tests than we did, I would even say, last week and the week before, because you weren't seeing many people in the ER at all, and hardly any people on the floor. And last night, there was a whole lot more, and I felt like they were just testing everybody last night. They didn't even have to have a fever, and they were getting tested.
Yeah.
And the test turnaround time is only 3 hours, so
okay.
It's great.
You said it was a couple of days, just a couple of weeks ago then.
At first it took a long time.
Okay. What are the kind of people that you see are testing positive? The media is saying that You're seeing a lot of older people. You're seeing a lot of minorities. Is that what you're seeing when you're sending somebody to the the positive line, I guess you would say?
That is true. That is very true. Um, People of minority,
Okay.
like you can almost like look at their chart and say, yep, this one's going to be positive. Like by looking at their labs, because we look at certain labs, and everybody that I've had that's positive except one has been somebody of color.
Wow.
That's anywhere from Puerto Rican to Hispanic to Somalian to African American, like all cultures.
Sure.
Guatemalan.
Sure.
I think I've seen like every culture,
That's interesting.
unfortunately.
That's interesting to know that. That's what makes that interesting is when you look at some of the European countries that were hit hardest, they don't have large populations of minorities. So it's interesting that that's happening here. I'm not sure, what the reason is for that. I got my theories, but that's not what we're here to talk about today. So, I have a couple more questions for you. What should people know about this virus that maybe we're not hearing in the media, in terms of, we've already talked about what to look for, but maybe in terms of the severity or the lack of severity, maybe they're overhyping things, just based on what you're seeing on your day-to-day life and dealing with this, what are things that they're not telling us or things that we should know?
I don't feel like they're overhyping it, because like people that have the flu, yeah, they have the flu and they get better, and some of the symptoms are similar, but COVID seems to move faster and fierce. It's fast and fierce. So they could be on 1 liter of oxygen, 1 hour, and then 20 minutes later, you're turning them up to 4. And at 6 liters now, 6 to 7 liters, we're having to intubate patients. And prior to COVID, we weren't doing that. That's not the protocol.
Intubate, what does that mean? I've heard that word thrown around a lot. Maybe you could explain that for us.
So it's a breathing tube, or the machine has to breathe for you, because the lungs, they just can't, they're just tired, because they fill up fast. They get these ground glass opacities, that's called, and atelectasis in their lungs, and it's just a lot of work for them to breathe. So like their normal respirations will be like 12, 16, 18, 20. Well, all of a sudden they're breathing at 40 breaths a minute. And an hour ago they were fine and they were talking and everything was fine.
Happen just like that.
It can happen just like that, really fast. And then and when they go on the vent, the likelihood for them to come off the vent, I'm not sure the numbers on that, but they're low.
Yeah, I've been hearing, that, some people are recovering, but they might have permanent lung damage. They might be on a ventilator the rest of their life, that's scary. That's scary to know. So what you're telling us is like, this isn't something that we should be taking lightly. Like and we're not going to get into like our opinions as much as just kind of like from your perspective, when you're seeing people out protesting and you're seeing governments and people wanting to open up everything back up right away. From your perspective, how does that look to you? Do you think it's a good idea? What does that look like from your perspective?
I think they could open up some things with a lot of caution. Like they could open up a barbershop or a hair salon and, have 1 customer or 2 customers in there at a time, 6 feet apart. Because to me, it wouldn't be any different than going to the grocery store. There are more people in the grocery store than there are in a barbershop. But I think it's just doing things smarter than we did before.
Okay.
And I think, I know people are losing money and everything is very hard right now, but it's also harder when young people are dying, and it's very sad.
What's the youngest person that you've seen that you've treated that was tested positive?
22.
22, and the oldest?
87.
Okay, so that's a wide range there. And that's just your experience. There could be others that we don't know about. And but you would say it's still, you had said earlier, it's still people of color and people that are older are typically the higher risk. Correct? That's still true.
Yes, okay. And people that are obese, and have hypertension and are diabetic.
Yeah.
Those three things also put them at a higher risk.
Yeah, and see,
And
we were talking earlier before we started this call about, our diets and what we eat, and I think that's something that that people need to be aware of. It's like, if you're eating processed foods, refined sugars, drinking a lot of alcohol, all smoking cigarettes, all that stuff puts you at higher risk to catch this virus because it lowers your immune system, and you're not creating as many antibodies. Not exercising, all that stuff, puts you at higher risk. So I got a couple more here. What are some things that you are dealing with just yourself on the front lines, and that the nurses and the physicians are dealing with, that we should know about in the public, that maybe they're not telling us about, or maybe we can't even wrap our minds around? Like, what are some of the crazy things? I know you've mentioned that to me in a different conversation, that before you go home at night, when you get home, you have to strip down naked in your garage before you can even go in your house and take off all your clothing. Talk about that. Maybe talk about some other things that we don't know about, so we really understand what you guys are going through.
just, I feel there's a lot of depression now. A little bit, the morale is a little different. And because nurses, we used to have a lot of potlucks. Now, not so much. Not last night. I worked at the facility I've been at for 7 years, and we always celebrate everybody's birthday. And she didn't even tell anybody it was her birthday last night. And that was kind of sad. And yeah, we're not celebrating birthdays. I feel like there's a lot more depression because we go there and we take care of these patients, and we're all suited up and they can't see us. And then we come home and we have to go through this process to come in our homes, and then we are in isolation. And so, at home we have to stay, home. And it seems to be a lot of sadness lately.
Yeah. I was listening to a podcast, this guy named Dr. Hyman I listened to. Actually, part of the reason I had reached out to you was I was listening to his podcast when they were describing certain things that were going on, and I was like, let me reach out to her and see if she'd be willing to tell her story. But I was listening to a podcast, and I think that he was interviewing Katie Couric because she had interviewed a lot of different people, involved in this situation. And he said, what do you see was one of the biggest, fallouts from this happening. And her response was, post-traumatic stress disorder for healthcare workers, because they're literally from some scenes, and you're not you're not in the COVID ward, you're in the separating room, but they're saying like things that are going on in New York, New Jersey, Italy, and Spain. It's like a war zone, and there's people just bodies laying everywhere, and people having to deal with that. Do you think that that's something that you talked about depression? Is this something that's going to have a lasting effect on you or maybe some of your colleagues?
Yeah, this whole experience, because the way just the patients, they're so isolated and they're scared. Just like the 22-year-old I had, she came in and she doesn't use oxygen at home, and then she's just a normal young person, going to school, and then all of a sudden now she has COVID, and now she's on oxygen, and she's scared, and she doesn't understand, and she can't have her family there. And then a few hours later I was talking to her, if you're unable to make these, decisions for yourself, would you like me to call? And 18-year-olds don't think about those things. And those are really hard conversations.
Yeah.
And to try and get the doctor in there to have a conversation with her is even more difficult, because we're using iPads for the doctors to have visits to minimize contact.
Yeah.
So we don't get to use iPads to take care of them, but that's what they're doing to minimize their contact. And it's just so hard because the families can't see them, and if they don't have a cell phone, then it's sadder. And then when patients are dying, families are having to say goodbye on the telephone.
I've heard that, like through FaceTime, and yeah, that's terrible. So you're not only dealing.
It's so sad. They don't even see them at all.
You're not only dealing with the physical threats of this disease and the physical harm that this disease can cause, but you're actually absorbing people's mental and emotional stresses, because you're probably one of the few people that they're able to see or going to see for a long time outside of their healthcare physician. So I don't think people are fully understanding the pressures you on. And you guys, you told me before, you're not getting paid extra for this, correct?
No, there's no extra money at all. There's no.
Yeah.
Our retirement has actually gone down.
Yeah, a lot. Yeah, mine too.
Yeah, they're not, no extras, no bonuses.
Yeah.
Right now, in Minnesota, since we're not considered a hot spot, you don't even actually get all your hours worked. They're way over on nurses every day, like 20-something nurses.
Oh, really?
Because not enough patients in the hospitals because we're not doing surgeries. We're not doing a lot of the things that we usually do every day.
Yeah.
So
I
there's.
know, I know. I'm on the board. I'm on the board for a medical clinic, and we furloughed like pretty much the entire staff. Because there's no surgeries. It's either COVID or nothing.
Yeah. So
That's crazy. Well, in wrapping up, is there anything going on that you just want to tell everybody out there, just based on your experience? If you could give somebody that's listening kind of, the word of the wise, what you're going through, or just anything you want to say as we wrap this up.
Just be patient and understanding, and imagine if it was you being in that bed, being isolated, being alone, possibly dying. So.
Yeah. Well, I'm going to, I just want to say thank you. I'm going to stop recording and then I'll wrap up with you. But I just want to say thank you very much for taking time out of your day and out of your schedule to sit and talk with me. Hopefully this will help, help with some people understand what's going on. I think the really good thing is we talked about the two big symptoms that we should look for, the three really, but the two big ones, the fever and the dry cough. I mean, I know that's great because I want to know that for myself, because I'm still out here working. And so I'm still coming in contact with some people, not a whole lot. So that's great information. And I really thank you. And I really want to say thank you very much for all that you're doing. I want to thank you and your colleagues for, working so hard and working 12-hour shifts and putting your lives in danger in order to save other ones. That's just something that's amazing. I really think that moving forward, after this is all over with, you guys will be looked at along the same lines as police officers and firefighters, how they were looked at after like 9/11, kind of like their status was elevated and people have more respect for what they do. I want you to know that me personally, I have more respect for what you do. Just the story you just described of like wearing PPE and like talking to somebody and taking their blood, like I'd be terrified, man. So I have a lot of respect for you. And I want to say thank you.
Thank you. Thank you.
I'm going to wrap everything up here and then we can talk for a second. So thank you very much, everybody. Thank you for listening. Thank you for tuning in. I hope you guys were able to get some value from this, and stay tuned. We'll have more stuff for you coming down the road.